Hi everyone. So we are going to talk about the health development or health promotion in the young child and adolescent. And I'm also going to touch a little bit on the infant, just because you're going to need to know that. And I know that infant is encompassed here. So first, I just want to talk about the theories of development that we know that we talk about in psychology, in education classes, in like every soft science. You're always going to go through theories of development as well as the hard sciences. So there's personality development, we should talk about. There's the two main ones, which is Freud and Erikson. Freud is more linked to psychosexual. Erikson is more linked to psychosocial. And then mental development, Piaget's cognitive, and Kohlberg's moral. So Erikson's stages of psychosocial development. So we talk about infancy, which is birth to 18 months. All right, so a lot of you guys are like, oh my gosh, I'm having nightmares. Do I have to know this again? And guess what? You do, especially for those of you who want to go back and be a nurse practitioner. You will have to know Erikson's stages of psychosocial development, not only because you actually literally have to know them by heart and be able to talk about them in your boards, but they also... it does get a little easier because you will also have to know them to understand health issues and diagnoses with adolescents, okay? So I remember in nursing school being like, thank God I don't need to know that anymore. And now I'm like, no, I have to know it. But of course, for those of you who have children, it does get a little easier because it makes more sense. You're seeing kids go through each psychosocial development. And also, as you go into adulthood, this makes some sense as well, okay? It's not crazy the amount you need to know, but you will need to know it. Now, I will say life does get easier when you are out of school because you get to look things up. So just remember that. In life, you can look things up. On a test, you can't, but in life, you can. Okay, so Erikson's stages of psychosocial development. There's infancy, which is birth to 18 months. And this is the ego development outcome of trust versus mistrust. So baby is learning who they trust and who they don't trust, and what they can do that they trust and what they don't want to do because they don't trust it. So the idea of when your child goes through stranger danger, stranger anxiety, that is a developmental milestone with trust versus mistrust. So if someone hands me a newborn who is relatively dry and fed, they will not likely as cry as when you put an 8-month-old in my arms that doesn't know me. And the same goes with giving a new baby mashed carrots and then giving your 18-month-old mashed carrots. They might just all of a sudden mistrust it because it's not the same thing that they're eating all the time. And so their basic strength is drive and hope. Okay, so then toddler is 18 months to 3 years. For those of you with toddlers right now, I'm one of them. I salute you. So their ego development outcome is autonomy versus shame, meaning this is when we start talking about potty training, autonomy versus shame. So they want to do things independently, and also they're learning that there are consequences to their actions. The basic strengths from this come self-control, courage, and will. And of course, that self-control is something that we have to reinforce with timeouts and mommy crying after because her daughter doesn't stay in her timeout. She escapes. That's what my 5-year-old said. She goes, Mommy, Georgia escaped timeout again. Okay, the preschooler, 3 to 5 years. This is my son. Ego development outcome, initiative versus guilt. So doing things for themselves without being told and feeling good about it. And then, of course, guilt when they fail at things. And their basic strength here is they're developing purpose. They're realizing that with start and stops, they can learn new things. You know that shirt that says, I can do hard things? That's that stage. So school age is 6 to 12 years. Ego development outcome is industry versus inferiority. So being industrious, meaning they are performing work with outcomes, maybe new outcomes, versus inferiority, so feeling less than. So when you look at ego development outcomes, You want them to feel industrious versus inferior. So the outcome of this age group is obviously the first, right? And if their developmental aspect has failed, they'll land in this latter category. So it's something to keep in mind. Now, I'm not saying as parents this is what happens. I'm saying this is how Erikson said if a person's ego is not developed properly, they will land in inferiority versus industrious. And their basic strengths are method and competence. So they're learning about methods and they're becoming competent in different skills, cause and effect, step by step, reading directions. Adolescence is 12 to 18 years, probably those the most angsty years of all your life. Ego development outcome is identity versus role confusion. So if adolescence isn't supported properly, there's going to be role confusion. Those who escape adolescence properly ego developed will have a sense of identity. I'm not saying that if you didn't have a sense of identity when you turned 19 that you weren't raised well. This is what Erikson is saying in general terms of psychosocial development. And basic strengths are devotion, so that's where you get that loyalty, and fidelity, which is truth-telling. So the theories of development, you have Piaget, which is mental, and Kohlberg's, which is moral. Piaget talked about sensory motor, which is birth to 2 years, and that's them touching and sensing and being able to move. So, you know, babies putting things in their mouth and clapping their hands. Pre-operational is figuring out how things work, 2 to 7. And concrete operations is actually knowing how things work and doing it themselves. Informal operations, being able to extrapolate that further. So Kohlberg's moral, there's pre-conventional, conventional level, and post-conventional. So the pre-conventional level, they talk about good and bad versus right or wrong. Conventional level is approval by being nice, right? So getting approval from others, fitting in. And post-conventional, autonomous, or principled level is again the formal operations where they're able to realize good, bad, right, wrong, fitting in, being nice, and when that's good for you to do, not good for you to do, and that things are interchangeable, and also it's not always black and white. So in Piaget's stages of cognitive development, we think of sensory motor periods years 0 through 2. So in this stage, infants construct an understanding of the world by coordinating sensory experiences, right? So they see and hear with physical and motor actions. So they see their mommy and they grab their mommy, right? They smell their mommy and they grab for mommy. They hear daddy and they smile. They hear baby brother and they clap. Infants gain knowledge of the world from the physical actions they perform on it. So I don't know if any of you have been through the adoption journey. I have not personally, but I have many friends who have, and I read their blogs, and they talk about how there are these children who are cognitively impaired for the time being because they are left in their cribs all the time, so they don't have much sense and motor actions in their crib. So the seeing and hearing of the world don't mix with the physical and motor actions. Oftentimes they catch up with that, but it's very interesting how important these young ages are for babies to be put in different environments and to be able to fully experience their sensory and motor. An infant progresses from a reflexive stage, so you've talked in school in pediatrics about the reflexes that they have, right? Like Morrow reflex and Babinski, so reflexes are instinctual actions, and to symbolic thought toward the end of the stage. So object permanence is a key word. I always forget it, but it's that idea of why babies realize when you're out of the room and they start crying that an object now has permanence to them. They understand the time-space continuum. So they see mommy and mommy leaves, they feel that sense of loss. They knew that you were there. They remember mommy. So they feel the loss of that object. I'm not saying mommy's an object. So infant stimulation is really important. Newborns prefer human face for stimulation. There's a reason why they tell you to hold your baby at your breast, to do skin to skin. There's a reason why breastfeeding is an important bonding exercise. And for those of you who didn't breastfeed, that's not a bad thing. You held them and fed them their bottle, which is one of the reasons why they discourage propping of the bottle. Not to say there's not other reasons, right? There's aspiration and all that. But Now, so if someone says, well, I had to prop, I had to study and do this, that doesn't mean you didn't love your baby. There's so many other ways to do FaceTime to stimulate with your baby. Visual benefit of black and white objects for simulations, why you see infant toys have black and white, and then you see reds, and then you see more colorful toys as age groups move on. Stimulation of human voice. There's a reason why we use baby voices. See, isn't that so obnoxious unless you're talking to a baby? That's because babies hear that higher tone better. And then, of course, importance of tactile stimulation when we talk about baby massage and kissing baby. And there's a lot of reason behind the tactile stimulation, right? One is that if you're nursing, they say the more you touch and smell and kiss your baby, your body develops antibodies. That's specific for your baby. That's important. But also it's that bonding, smelling moment for baby too. So that's why brothers and sisters and partners, co-parents, grandparents, those around baby should be involved in this tactile stimulation.